In many ways, the healthcare systems of Japan and the United States are a study in contrasts. Both nations have achieved incredible advances in medicine, but their approaches are wildly different. Healthcare is a human right. It's a privilege reserved for those who can afford it. One system covers all residents, the other leaves millions without coverage. One system heavily subsidizes care to make it affordable, the other shifts that burden to patients. So which is better? We'll examine the numbers and findings from the OECD to break down how these two healthcare systems really compare. Japan first. Japan is considered to have one of the best healthcare systems in the world. How does it work? First, the basics. Japan is an island nation with a population of around 125 million people. Its healthcare system is primarily a single-payer system known as the National Health Insurance (NHI). This means that the government is the primary payer for healthcare services. But before we go further, I want to clarify that Japan isn't technically a single-payer system, because there are actually several entities involved. The way it works is that residents are initially mandated to join one of two insurance pools, either through their employer or their local municipality if they're unemployed. But don't worry, if you don't like your assigned pool, you can move to another one. Everyone must be insured though, so you can't just opt out. Once you've joined an insurance pool, you'll pay an insurance fee. This fee is based on a sliding scale, meaning that higher earners pay more and everyone is charged a slightly different amount. The exact amount is decided annually by the central government. Your employer will deduct this fee from your paycheck if you're employed. If not, then you'll pay it directly to your city office. Now, this might sound like a lot of paperwork, but trust me, that's part of the system's charm. Everything is incredibly organized. Every resident has a health insurance card and it's used everywhere, just like your health insurance card back home. So no need to worry about submitting claims or anything like that. And here's the best part. With this card, you won't have to pay out of pocket when you seek medical care. Well, almost. Normally, patients pay about 30% of the cost of their care. That might sound like a lot, but keep in mind that most medical services are heavily subsidized. So the actual out-of-pocket costs for most people are pretty low. If you're feeling extra generous, you can even choose to pay more into your insurance plan. Doing so reduces the percentage of your medical expenses that you'll have to pay out of pocket. Or if you're having a tough time financially, then you may qualify for extra subsidies that can help you cover your healthcare costs. Moreover, there are caps on how much you can be asked to pay out of pocket every month. Those limits are set based on your income. Additionally, some procedures such as vaccinations and cancer screenings are completely free. So what does this look like in practice? Let's say you have a regular checkup at your local clinic. You show your insurance card, and since you've paid your insurance premium, you won't owe anything. If you need to see a specialist, then you might need a referral from your general practitioner. But once you get that referral, you can usually see the specialist without paying anything else out of pocket. As for major procedures like surgeries, you'll still pay the 30% copay, but that's it, no additional fees. Imagine going to the hospital for a surgery and only paying a $30 surcharge. That's unheard of in the US and most other places. That's why Japanese patients rarely have to worry about the financial burden of illness or injury. It's one of the reasons why Japan has one of the highest rates of appropriate medical utilization in the world. People don't avoid going to the hospital because they can't afford it. They simply go and get treatment. Now let's turn to the United States. The United States is one of the wealthiest nations in the world. Yet despite its vast resources, it doesn't offer health care to all people living within its borders. Currently, there are around 75 million people in the US who are uninsured, leaving them without any form of health coverage. For another 75 million Americans, their insurance plans have limited coverage, forcing them to pay high out-of-pocket costs when they seek medical attention. When it comes to the remaining 200 million Americans who do have health insurance, the quality and scope of their coverage varies significantly. Most individuals obtain health insurance through their employers. However, the responsibility for providing insurance falls on the shoulders of the employer. Some companies opt to offer comprehensive plans, while others provide more limited coverage. Additionally, there's a substantial difference in how much employees contribute towards their insurance premiums. The U.S. healthcare system allows for a wide range of choices, but unfortunately, this flexibility often translates to high costs for consumers. So what does this mean in practice? Well, let's say you're not yet 65 years old and therefore not eligible for Medicare. And let's say that you don't have a job with health insurance. Then you might qualify for Medicaid, a government program that offers free or low-cost health coverage. Eligibility criteria for Medicaid include factors like your income, household size, disability status, and pregnancy. If you meet the requirements, you can receive comprehensive health coverage, including doctor's visits, hospital stays, mental health services, prescription drugs, and more. But remember, this is a means-tested program. If your income exceeds the limits, then you'll lose your eligibility. And if you're not eligible for Medicaid, then you'll have to purchase health insurance on the individual market. Here, you'll find a variety of plans to choose from, but the prices can be quite expensive. On average, health insurance premiums in the U.S. cost around $470 per person per month. If you're buying insurance for your entire family, that price nearly doubles to an average of $880 per month. But wait, there's more. These premiums only cover a portion of your medical expenses. Under most plans, you'll still have to pay co-pays for doctor's visits, deductibles before your insurance kicks in, and even encounter surprise bills for services that aren't covered. This complexity often leaves Americans confused about their healthcare coverage and costs, leading many to forego necessary medical care. So how much do Americans pay out of pocket for healthcare? The answer varies widely based on a person's insurance plan, but the average American spends around $1,500 per year in out-of-pocket costs. Those costs can include co-pays, deductibles, prescription drug costs, and dental or vision expenses. But even with insurance, Americans still pay a lot. The U.S. spends around 17% of its GDP on healthcare, one of the highest rates in the world. Japan, on the other hand, spends around 10% of its GDP on healthcare. In terms of access, the Japanese system also has the edge. Primary care doctors are generally very accessible. In fact, there's one for every 1,500 Japanese people. And because specialists are also in ample supply, getting referrals is not a big issue. As for hospital care, Japan boasts 37 hospital beds for every 10,000 residents. That's 4 times the rate in the U.S. in rural areas where hospitals are often scarce. Ambulances play a vital role in ensuring that people can access medical care. When it comes to technology and innovation, both nations lead the world. Japan excels in preventive care, robotics, and elder care, while the U.S. leads in pharmaceutical research, surgery, and cutting-edge treatments. However, the U.S. system often prioritizes high-tech interventions over routine checkups, whereas Japan emphasizes the latter. So what about health outcomes? Despite spending half as much per capita on healthcare, Japan achieves better results in terms of life expectancy, infant mortality, and lifestyle-related illnesses. Japan has one of the longest life expectancies in the world, with men living on average 281 and women 287. In contrast, the U.S. ranks lower with life expectancies of around 78 for men and 81 for women. Despite their differences, both systems have strengths. Japan's system is highly efficient and equitable, but it can be bureaucratic. The U.S. offers world-class care, but at a high personal cost. Both are constantly evolving and hold valuable lessons for the future of global healthcare. What do you think? Which system is better? What should other countries learn from these two models? Let us know in the comments below. And as always, thanks for watching.